Hello and welcome back. My name is Jay and currently I work as an intern. First of all, I would like to apologize for the inordinate delay which was caused in posting the MCQs of Pathology Paper 1. It was a very close finish with respect to the timing of your exams, and I'm not sure many of you went through them. But from what I have gathered, many of the MCQs were past repeats, and the paper setters of Pathology uh, haven't taken much efforts to put in some new questions. So doing or revising previous year questions is a short way to secure your marks. And for short answer questions and long answer questions, uh, since Patho 1 was relatively easier, I think Patho 2 would be slightly on the tougher side. It is always better to be well prepared because it's pretty vast and MCQs would come to your rescue at this point in time. And there are specific topics which are highly tested, such as thyroid cancers, ovarian tumors, or bone tumors, then something related to ulcerative colitis versus Crohn's disease, then related to your stomach, esophagus. So these are highly tested topics which are repeated again and again, and subtopics within them. So as we'll see with the MCQs, you'll get to know the gist of it or get a hang of it. So without further delay, let's start Pathology Paper 2 discussion from summer 2013 to 2019. And I hope that I'll be able to post it before time. So let's begin. Right. Let's start in the reverse order. The first question is, complications in atherosclerotic plaque include all except. Now, atherosclerotic plaque, what can happen? Can that plaque rupture? Yes, so that can lead to hemorrhage into the vessel itself, which can lead to aneurysm. Can that plaque undergo changes which can lead to embolism? Yes, it can embolize. Can that plaque undergo calcification? Yes, it can undergo dystrophic calcification as well. So ulceration, hemorrhage, yes. Infection, no. Plaque generally does not get infected. Calcification, yes. So the answer is C. Pap smear test is mainly used for screening of which cancer? Now see, Pap smear, Pap stands for Papinicolau, and it is a screening test for cervical cancer. So it is based on the concept of exfoliative cytology, that normally cells are shed, and these cervical cells which are shed, they are then visualized with Papinicolau stain, and you look for anaplasia or lack of differentiation within those cells, and then you determine whether these are cancerous or not. Clincher will always be the cervical biopsy, but for screening initially, you use a Pap test. Autosplenectomy is seen in sickle cell anemia. The spleen undergoes self-destruction, so it is sickle cell anemia. There's no doubt about it. Whereas AIHA, autoimmune hemolytic anemia, spherocytosis, you'll have splenomegaly. In sickle cell anemia, also there's destruction of RBCs, but the spleen also undergoes destruction. That's why it is known as autosplenectomy. Gross appearance of kidney in benign nephrosclerosis. Now, gross appearance of kidney has been asked every alternate year. So you need to remember only two conditions: infective conditions and hypertensive conditions. In hypertensive conditions, you'll have a small contracted granular kidney. In infective conditions, you'll have a flea-bitten kidney. You'll have multiple petechiae. So that's known as a flea-bitten kidney. It appears like the flea has taken multiple bites of that kidney. That's why it's known as flea-bitten kidney. Flea-bitten kidney, all your infections, post-streptococcal glomerulonephritis, rapidly progressive glomerulonephritis. Contracted granular kidney is seen in hypertension. Large pale kidney is generally seen in amyloidosis. So that is amyloid. Kidney with broad deep scars, that is seen in pyelonephritis. Cool. The following type of renal calculi is radiolucent. Radiolucent means that it cannot be visualized. It is uric acid. Again, it's a no-brainer. You'll have to remember it. Oxalate, struvite, cysteine, all are radio opaque. That means they can be visualized in a non-contrast CT, right, or in an X-ray. Common site for osteosarcoma. Osteosarcoma is a metaphyseal tumor. Please remember it. Which tumors are metaphyseal, which are diaphyseal, which are epiphyseal. So in epiphyseal, generally you have giant cell tumor, GCT. In metaphyseal, you'll have osteochondroma and osteosarcoma. And generally in diaphysis, you'll have fibroma, right? Fibroma, aneurysmal bone cyst, things like that. Barrett's esophagus, example of columnar metaplasia. So the stratified squamous epithelium of your esophagus is converted into your columnar epithelium. I guess the mechanism of metaplasia was asked in your exams. Metaplasia is basically de-differentiation. Your stem cells are there, they were differentiating along a particular line. Now they'll differentiate along another line. So earlier they were differentiating along squamous cell line. Now they'll differentiate along your columnar cell line, right? So the next question is, following is true about ulcerative colitis except. Now, ulcerative colitis versus Crohn's is a very important differentiation. All of you should know that. It's always better to go through it once before your exams. There are about 8-9 points, and if it comes for an SCQ, it's a bonus, right? You can write everything about it. So it mainly involves rectum and colon. That's true, because Crohn's involves anything from the mouth to the anus. Skip lesions are not seen. That's true as well. Skip lesions are seen in Crohn's, and Crohn's, because of skip lesions, you will have a cobblestone appearance. It is usually limited to mucosa. That's true as well. Granuloma is a histological finding. No, granuloma is found in Crohn's. Crohn's is chronic granulomatous inflammation. So granuloma will be found in Crohn's. Disease associated with H. pylori include all except peptic ulcer disease. Yes. Gastric carcinoma. Yes. Maltoma. Yes. Malabsorption syndrome. No, malabsorption is generally not caused because of H. pylori. Malabsorption is due to sprue, tropical sprue generally, or your protein losing enteropathies, Zollinger-Ellison syndrome, things like that, not due to H. pylori. Non-neoplastic colorectal polyps include all except. Now see, polyps can be either hypoplastic polyps, they can be a hematomatous polyps. So juvenile polyp is basically an hypoplastic polyp. Your Peutz-Jeghers polyp is a hematomatous polyp. Hematoma is a localized disorganized mass of tissue. It is not a neoplasm, it's a hematoma. Tubular adenoma, yes, tubular adenoma is a benign neoplasm, and you have a lymphoid polyp. So they have asked non-neoplastic. So A, B, and D all are non-neoplastic. But tubular adenoma is a benign neoplasm, and that has the maximum potential for carcinomatous transformation. So the answer is tubular adenoma. Most common site for peptic ulcer disease is lesser curvature of stomach. Now, why lesser curvature of stomach? 1 second. Yeah, so the answer is first part of duodenum. Lesser curvature of stomach is more prone for caustic injury or chemical injury, but first part of duodenum is more prone for your peptic ulcers. Right. So the answer is D. It's not B, it is D. Psammoma bodies, which is dystrophic calcification, they are seen in. Now, psammoma bodies, I want you to remember 4 conditions in which psammoma bodies are seen. It's meningioma, serous cyst adenocarcinoma of ovary, papillary carcinoma thyroid, and papillary variant of renal cell carcinoma. In all of them, you'll find psammoma bodies. So this question they have asked specifically with respect to thyroid cancer. So with thyroid cancer will show psammoma bodies, it will be papillary carcinoma. Late complications of chronic pancreatitis include all except. Now, due to chronic pancreatitis, what can happen? You will not have trypsin, chymotrypsin. As a result, proteins will not be digested, so you'll have malabsorption. Steatorrhea, yes, because lipases would not be there. You'll have loss of fat. Proteinuria, will protein be seen in urine? No, that was seen in nephrotic and nephritic syndrome, not in pancreatitis. Diabetes mellitus, yes, because the endocrine function is lost. Insulin won't be produced. Bowen's disease, also remember, Bowen's disease is squamous carcinoma in situ. So the answer is squamous cells. Right. Pigment stones in cholelithiasis are due to. Now, cholelithiasis is basically gallstones. So gallstones, their bile will not come into your small intestine. As a result, there's stasis and stone formation. And stone formation will have the pigment bilirubin. Ovarian dermoid cyst is an example of. Now, ovarian tumors are time tested again and again. So ovarian tumors, generally 4 types. You have epidermal tumors, you have your surface epithelial tumors, your germ cell tumors, stromal tumors, and metastatic tumors. Let's start with metastatic tumors. Krukenberg's tumor is the most common metastatic tumor to the ovaries. So it can be from the breast, it can be from the colon, or it can be from the stomach. So all of them are basically metastatic. All of them are basically sites of primary tumors, which can then metastasize to your ovaries. Right. So that is your 1 sec. That's basically your metastatic. Surface epithelial tumor, you'll have epithelioma. You can have what do I say? Besides epithelioma, you can have a mucoepidermoid tumor. So things like that are generally epithelioid. And germ cell tumors, all. Dysgerminoma, which is the seminomal counterpart in females. Then you can have teratoma or dermoid cyst. You can have choriocarcinoma. You can have yolk sac tumors, embryonal carcinoma. All of them will be germ cell tumors. So the answer is dermoid cyst is an example of germ cell tumor. So we are done with winter 2019, right? So let's do with summer 2019. So the first question is, causes of flea bitten kidney are all except. Now I've mentioned it again. Flea-bitten kidney, all infectious causes. Post-streptococcal glomerulonephritis, yes. RPGN, yes. Hemolytic uremic syndrome, yes. Henoch-Schönlein purpura will also be there. Benign nephrosclerosis, no. Nephrosclerosis will have small contracted kidney. So the answer is D. Following thyroid cancer, neuroendocrine tumor. Which is a neuroendocrine tumor? Remember, it is medullary carcinoma because it produces calcitonin. That's why it is known as a neuroendocrine tumor, right? So the next one, major complication of typhoid ulcer. Now, typhoid ulcer will generally cause perforation. Typhoid ulcers are longitudinal ulcers. Right. So they have more chance for perforation, whereas your gastric ulcers, they are basically circular ulcers and they have more chance for bleeding. Women carrying BRCA1 mutation gene are likely to develop which of the breast carcinoma? It is medullary. Remember, BRCA1, poor prognosis, medullary carcinoma. Schiller dual bodies are seen in, again, it's a fact-based question. There are multiple bodies which you would need to remember. I'll just mention 2-3 of them because these are repeated in your previous MCQs. So Schiller dual bodies are generally seen in endodermal sinus tumor. Then you have Negri bodies. Negri bodies are seen in rabies, hippocampal neurons of your brain. Then you have Verroque bodies. Verroque bodies are seen in schwannoma. Then you have Councilman bodies. Councilman bodies are seen in viral hepatitis. Then you have proceratin or keratin bodies generally seen in your alcoholic hepatitis, right? It will come, right? So Krukenberg tumors is bilateral metastatic tumor from stomach, yes. Breast, yes. Colon, yes. Endometrium, no. Right. Malady bodies, malady dengue bodies are basically accumulations of keratin. So they will be seen in non-infectious conditions of your liver. So except for viral hepatitis, all of them will have malady dengue bodies. Alcoholic liver disease, Wilson's, hepatocellular tumors. Most common location for carcinoid is. Now, most common location for carcinoid is generally the appendix followed by the terminal ileum. Now, appendix and ileum both are a part of midgut. So the answer is midgut. It's good to know the 3 parts. The foregut is from the mouth up to the second part of duodenum. From the second part of duodenum up to 2/3 of transverse colon is your midgut, and 1/3 transverse colon, descending colon, rectum and anal canal, that is your hindgut. So the most common location is your midgut. True regarding Crohn's are all except. So what is Crohn's? Chronic granulomatous inflammation. Does it have scleroderma? Let's see. We don't know yet. Transfural involvement? Yes. Ulcerative colitis is only mucosal involvement. Crohn's is transfural involvement. Cobblestone appearance? Yes. Skip metastasis or skip areas? Yes. Not skip metastasis, my bad. Skip areas? Yes. Whether ulcerative colitis is continuous. Most common type of gastric polyp is, you need to remember, it's a hypoplastic polyp. Yeah, it's hypoplastic polyp. It's not malignant, it's not hematomatous. It is hypoplastic. Most common polyp in your intestine is basically your Peutz-Jeghers polyp, which is a hematomatous polyp. Undescended test is which tumor is going to be seen? It is seminoma. It's not teratoma. Teratoma is a developmental tumor. So it's an embryonal type of tumor. Seminoma is an acquired thing. So in undescended testes, most commonly develops seminoma. Most common form of glomerulonephritis. Now there are 4 questions. Listen to them very carefully. Most common cause of nephrotic syndrome in children, it is known as minimal change disease or benign nephrosis. Minimal change disease is the thing, or lipoid nephrosis. Minimal change disease or lipoid nephrosis. In adults, it is focal segmental glomerulosclerosis. So minimal change disease in children and focal segmental glomerulosclerosis or FSGS in adults. Now for nephritic syndrome, most common cause in children is PSGN, post-streptococcal glomerulonephritis. Most common cause in adults is MN. MN is your membranous glomerulonephritis. I hope this makes things clear. Following type of bronchogenic carcinoma, worst prognosis. Worst is always small cell carcinoma. In non-small cell, then you have your squamous cell and squamous and adenocarcinoma, right? All of the following are seen in asbestosis. Now, asbestosis is an interstitial lung disease. It is not a COPD. It is not a pulmonary parenchymal disease or a airway disease. It is basically an interstitial disease, not an airway disease. So, diffuse pulmonary interstitial fibrosis will be seen, yes. But besides, asbestosis also involves your pleura. So, the most typical carcinoma which is associated with asbestosis is your pleural carcinoma, which is known as a mesothelioma. So fibrous pleural thickening, yes. Calcific pleural plaques, yes. Emphysema, no. Emphysema has no relation. Most common type of paraproteinemia, most common type has to be IgG, multiple myeloma. Major criterion for diagnosis of rheumatic fever: pancarditis, yes; subcutaneous nodules, yes; erythema marginatum, yes. Fever is a minor criteria, it's not a major criteria. So AHA classification of rheumatic fever, do it once, it's a high yield thing. So summer 2019 is done again. Right, so now let's focus on winter 2018. Right, so specific serum marker for patients with sickle cell anemia are more prone to develop osteomyelitis due to, it has been repeated n number of times, it is salmonella typhi. So it is salmonella. So in salmonella, in patients with sickle cell anemia, you'll see osteomyelitis secondary to salmonella. Specific serum marker for kidney function test, it's a physiology question. Kidney function test in the form of GFR will always calculate by creatinine, because serum creatinine will give an estimate of the effective glomerular filtration rate and the kidney function. Representative of mononuclear phagocyte system in CNSs. Now in CNS you have neurons and you will have neuroglial cells. The neurons are basically your nerve cells and neuroglia are your supporting cells. So which are the supporting cells and what are their functions? Very important, very high focus. Astrocytes will form your blood-brain barrier. Oligodendrocytes will form your myelin sheath in the CNS. In peripheral nervous system, it is formed by Schwann cells. Ependymal cells will basically form your choroid plexus, CC, yeah, and blood-brain barrier for at the choroid plexus formation and secretion of CSF. Blood-brain barrier is astrocyte, and microglial cells have phagocytic activity. So the phagocytes of your CNS is your microglia. All of the following is true about acute pancreatitis except cholelithiasis can be the associated condition. In fact, cholelithiasis is one of the most common conditions, secondary to alcoholism. Second to alcoholism. Rise in serum amylase followed by lipase, that's true. A followed by L. Pseudocyst formation, no. Pseudocyst is seen in chronic pancreatitis. It is not seen in acute pancreatitis. Fat necrosis is a characteristic lesion, that's true. There is soap formation and deposition of calcium, which is dystrophic calcification. Type of renal calculi following infection by urea splitting bacteria, these are struoid stones. Now struoid is also known as triple phosphate, calcium, ammonium, magnesium phosphate. So it is option number A. Uric acid are radiolucent stones, right? Following statements are true about atherosclerosis except complicated plaques can predispose to microemboli, that's true. Fatty streaks seen in adults only, that's false. Fatty streaks can also be seen in children, and they are the sites where your future plaque formation can be there, right? So they are seen in children. Risk is inversely proportional to your HDL levels, that's true. Higher the HDL, lower is the risk. HDL above 50 is good in males, above 45 good in females. Macrophages in intima accumulate lipids. Yes, lipid-laden macrophages are also known as foamy macrophages. I have a gut instinct that this time maybe atherosclerosis can be asked as an LAQ. Prepare it well. Ovarian germ cell tumors include all except, see again they have asked, germ cell tumors. So is it teratoma? Yes. Choriocarcinoma? Yes. Endodermal sinus tumor as well. That's true. Fibroma, thecoma? No. These are your stromal tumors. These are not germ cell tumors. Right. Flash-shaped ulcers seen in amoebic colitis. Ulcerative colitis, continuous mucosal involvement. Amoebic colitis, flash-shaped tuberculous enteritis, you'll have circumferential ulcers. As a result, you'll have stricture formation. Typhoid enteritis, longitudinal ulcers, increased risk of perforation. Emphysema resulting due to alpha-1 antitrypsin deficiency. Now remember, two types of emphysema, mainly centriacinar and panacinar. So just you tell me, if it is an enzyme defect, it will affect all of the acinus. Acinus is your respiratory bronchiole, alveolar duct, alveolar sac. It will affect your entire acinus. That will lead to panacinar emphysema. Whereas smoking will generally involve the central part of acinus. That's why it is known as centriacinar emphysema. So smoking associated centriacinar, panacinar is alpha-1 antitrypsin deficiency. Classical Hodgkin's lymphoma. Hodgkin's is again a very important topic. You cannot afford to miss it. Since it was not asked in your paper 1, I think it might be asked in paper 2. So you have classical Hodgkin's and you have non-classical Hodgkin's. Classical Hodgkin's, lymphocyte rich, lymphocyte depleted, mixed cellularity and nodular sclerosis. Nodular sclerosis has the best prognosis. And then you have non-classical Hodgkin's, and non-classical Hodgkin's will have lymphocyte predominant. And which is the cell you will typically see? It is, yeah, it is your popcorn cells. So popcorn cells seen in lymphocyte predominant. Maximum likelihood of developing chronic hepatitis in adults is after infection with Without any doubt, it is hepatitis B virus. Hepatitis B is a DNA virus, right? All of the following are true about fibroadenoma breast. Most common benign tumor, that's true. Regresses and calcifies after menopause, that's true because it's a hormone dependent cancer. During pregnancy, it shrinks in size, no, that's false. During pregnancy, it may increase in size because it's dependent on estrogen and progesterone. Biphasic breast tumor, yes, it has a fibrous component, it has a fatty component, fibrofatty stroma. That's why it is fibroadenoma. So it's in the name itself, it's then a fibrous and adenoma is glandular. So fibroadenoma. Two patterns, intracanalicular, pericanalicular, very important. Rodent ulcer is the designation for basal cell carcinoma. Remember, two cancers which are highly locally invasive, but they do not metastasize, basal cell carcinoma and glioblastoma, right? Now, again, vegetations. Vegetations has been asked twice or thrice. You should know which are the vegetations. 4 vegetations, right? Remember, first is rheumatic fever. Second is non-thrombotic bacterial endocarditis. Third is infective endocarditis. And fourth is your Lymphoma endocarditis. Now, rheumatic fever. Rheumatic fever generally followed by, it's a post-streptococcal manifestation, right? So, vegetations will be seen, small warty vegetations along the valve closure, along the line of valve closure. This is the typical sentence. Small warty vegetations along the line of valve closure. Which endocarditis do you suspect? It is rheumatic endocarditis. So rheumatic heart disease along line of valve closure. A group or a large vegetation or a large friable mass is suggestive of infective endocarditis. In Libman sac, you will find vegetations on both sides, upper leaflet or the atrial side of the leaflet as well as the ventricular side of the leaflet, right? Urine Benedict's test will be positive with all reducing sugars. Glucose, yes. Sucrose, yes. Fructose, yes. So all of the following. All of the above will have a positive Benedict's test because they are reducing sugars. Stages of lobar pneumonia, again, very important, and it's a halwa question because you can just remember it, and it's all acute inflammation. So you can just copy that as well. So 4 stages is congestion, red hepatization, gray hepatization, resolution. Resolution is the stage of fibrosis, right? It is not a stage of organization. There's no such stage. For thrombus, yes, you can have an organizing thrombus, but for lobar pneumonia, you won't. So the answer is D. So winter 2018 done, summer 2018. Statements are true about melanoma, except characterized by radial and vertical growth, true. Important clinical sign is change in color. Yes, change in color is a worse prognosis, poor prognosis. Benign tumor of skin, no, it's a malignant tumor. Specific tumors, despite the suffix oma, they are malignant. Seminoma, melanoma, your hepatoma, your chloroma, your chordoma, all of them, despite ending in oma, they are malignant tumors. So option C is incorrect. Enlargement of pre-existing mole is suspicious. Obviously, you will have a benign lesion which is enlarging. You will suspect a malignancy. Commonest glioma is, so the commonest glioma is astrocytoma. Remember it. Craniopharyngioma is a teratoma. Onion peel appearance on X-ray is seen in. Now, onion peel appearance on X-ray is seen in, again, it's a fact which you need to remember, it's seen in Ewing sarcoma. Ewing sarcoma is generally seen affecting your flat bones, your ribs, your scapulae. That's Ewing sarcoma. Most frequent association of squamous cell carcinoma penis is. Now see, HPV DNA virus, 2 types. Your low infectivity, or what should I say, having a poor malignant, lower malignant potential, higher malignant potential. Lower malignant potential is HPV 6 and 11. They'll form your anogenital warts or anomucocutaneous warts. That is your HPV 6 and 11. For cancers, you'll have HPV 16 and 18. 16 more than 18. So most frequent association of squamous cell carcinoma when penis is HPV 16. Which type of breast cancer likely to be bilateral? Now, there's an important statement which I'm going to tell you. Please remember it for the rest of your lives. It is important in surgery as well. Lobular carcinomas tend to be bilateral and multicentric. Remember it, right? Ram Vachan hai, isko yaad kar lo. Lobular carcinomas, bilateral, multicentric. Answer is D. Right. Which statement is about Krukenberg's tumor is not correct? One sec. One sec. Right. Which is not correct. Primary tumors of ovary. Yes, this is the incorrect thing because it's a metastatic tumor. It's not a primary tumor. Bilateral and solid, yes. Signet ring cells, yes. Associated with CA stomach in many cases. Associated with CA stomach, CA colon, and CA breast. Right. Medullary carcinoma thyroid is, now see, all carcinomas of thyroid, they'll arise from your follicular cells or your cuboidal cells, but parafollicular cells or C cells, they are responsible for medullary carcinoma thyroid. It's a neuroendocrine tumor. Answer is C cells of thyroid. 4-year-old boy, generalized edema, massive proteinuria. Diagnosis, nephrotic syndrome. Most common cause of nephrotic syndrome, minimal change disease, also known as lipoid nephrosis. Answer is A. If it would have been an adult, it would have been FSGS, which is focal segmental glomerulosclerosis. Following are hormone-dependent tumors. Ovarian, no. Ovaries will themselves produce the hormones. They are not hormone dependent. Endometrial, yes, dependent on estrogens. Prostate, yes, dependent on androgens. Breast cancer, yes, dependent on estrogens and progesterone both. Renal papillary necrosis, seen in all of the following, except diabetes mellitus, analgesic, sickle cell, SLE. So diabetes mellitus will show, that's true. Analgesic nephropathy, true as well. Sickle cell also true. SLE, no. SLE has no relation with renal papillary necrosis. So answer is D. Concentric hypertrophy of left ventricle. See, left ventricle hypertrophy concentric, only one thing should come to mind, systemic hypertension, because due to hypertension, your left ventricular wall will have pressure exerted on it from all directions, all equal directions. So it will have a concentric hypertrophy. If it was pulmonary hypertension, it would have been right ventricular hypertrophy. At the edge of myocardial infarct, presence of early granulation tissue is less than 1 week old. See, 1 to 2 days or 1 to 3 days, basically, there is neutrophilic exudation, acute inflammation. 3 to 4 days, or basically the next 3 days, you'll have replacement by mononuclear infiltration, your macrophages and your lymphocytes. Followed by that, you'll have fibrosis and your neovascularization. So that is less than 1 week. Viral pneumonias are characterized by, now viral pneumonias are basically atypical pneumonias. They are not lobar, they are interstitial. So you'll have interstitial infiltrates, that's true. Alveolar exudates of neutrophils, no. It is of lymphocytes. Bronchiolitis mainly, no. Inflammatory cell reaction in lung, no inflammatory reaction, false. There is inflammatory, but it is a lymphocytic inflammation. Earliest diagnosis of acute hepatitis B infection is made by presence of HBsAg. Remember it. First marker, most reliable marker, HBsAg, Hep B. Polyp associated with highest risk of malignant transformation is, I told you earlier, it is a tubular adenoma. 45-year-old woman with swelling in front of neck, that means she has goiter. With exophthalmos. Exophthalmos means it's a hyperthyroidism ka feature. So swelling in front of neck with exophthalmos, answer has to be Graves' disease. Even MNG can be there, but MNG does not present with exophthalmos, right? So in Graves, it's seen, you need to have Graves dermopathy, then there are 2-3 more things. I'm not pretty sure at this point in time, but just go through that. Pretibial myxedema is there, Graves dermopathy and exophthalmos. It's a triad, right? Right. So now we'll go to the previous question. Perforation of the valve is commonly seen in which? So valve perforation is seen in those endocarditis which has a chunk of bacteria. So that is bacterial endocarditis. It's a huge mass that can lead to perforation of the valve. Charcot-Leyden crystals are seen in bronchial asthma. Ferruginous bodies are seen in asbestosis. Charcot-Leyden crystal, bronchial asthma, right? And Reed's index was chronic bronchitis. Patient with hereditary retinoblastoma are at a greater risk of developing. See, even I am not sure of this question. They have given the answer as osteogenic sarcoma. So in all humility, if you find a better answer or if you find any reference, please tell me in the comment section below. Cyma bodies are seen in meningioma. Which are the 4 conditions? Meningioma, papillary carcinoma thyroid, papillary variant of renal cell carcinoma, and serous cyst adenocarcinoma of ovary. So Cyma bodies seen in meningioma. Bilateral and multicentric, I've told you n number of times. Lobular carcinoma tends to be bilateral multicentric. Answer blankly has to be B. Term cirrhosis was first introduced by Linnek. Remember, it is Linnek. So you have a type of cirrhosis which is also known as Linnek cirrhosis. So the term cirrhosis was introduced by Linnek. Now the next question is, all are true about Hashimoto's thyroiditis. So what is Hashimoto's thyroiditis? Is it an autoimmune disorder? Yes. Does it have autoimmune? That means there will be abundant lymphocytes. Yes. So it is known as adenoma lymphomatosum. That's true. Does it produce goiter? Yes. Goiter is any swelling. So you will have goiter, but a hypothyroidic goiter. So A is true. Also known as struma lymphomatosum. That's true. Dequervance? No. Dequervance is a painful thyroiditis, and that is caused due to a viral infection, post-viral infection. That is dequervance. Autoimmune? Yes, that's true. Which of the following is not a pre-malignant lesion? Leukoplakia and erythroplakia. White patch, red patch. Yes. Submucosal fibroid, yes. Submucosal fibroid is seen in people who smoke your cigarettes in the reverse way. The reverse, like the burning and they keep in that mouth, that leads to submucosal fibroid. Chronic ulcerative colitis, no, it's an inflammatory condition. It's not a pre-malignant condition. Familial polyposis coli, yes, it's true. So it is, answer is D. Answer is C. It's not a pre-malignant. A, B, and D are pre-malignant. One of the following following pneumoconiasis has increased risk of developing tuberculosis. Answer is silicosis. Remember it. Negri body is characteristically seen in rabies. I've told you. Alzheimer's disease, you will generally see Lewy bodies. Lewy bodies are seen in basically Parkinson's. Yeah. So the next question is multiple osteomas are seen in. So multiple osteomas are seen in Turcotte syndrome. You have to remember it. Serum alkaline phosphatase is markedly increased in obstructive jaundice. Again, it's a fact to be remembered. Krukenberg's tumor is bilateral metastatic tumor from following primary sites except stomach, yes, breast, yes, colon, yes, endometrium, no. So the answer is endometrium. Right. Endometrium. One second. Yeah. Yeah. So next is hepatic encap. Hepatic encap is basically due to accumulation of ammonia. So what happens in hepatic encephalopathy, or ammonia is not converted into urea, and ammonia is absorbed by the gut and it will go to your brain and it will depress your brain. So it will depress your CNS. So that is the pathogenesis of hepatic encephalopathy. Now, drug of choice is, this is just an extra information, drug of choice is lactulose. This was there in Pharmac as well, because lactulose will be fermented to form lactic acid and H+. So H+ release will combine with ammonia to form ammonium, and ammonium will not cross your gut barrier and it will not reach your brain. So the answer is toxic damage from ammonia. Most common anatomic site for squamous cell carcinoma of esophagus is your upper third. Lower third is adenocarcinoma, upper third is squamous cell carcinoma. Pankos syndrome is characterized by involvement of which thing? Pankos tumor is your apical lung. Basically, you'll have a tumor in your apical lung. It will compress your paravertebral sympathetic chain. So it will lead to Horner syndrome. So apical lung carcinoma, true. Cervical nerve involvement, true. Sympathetic nerve involvement, true. Brachial plexus involvement, no. Brachial plexus has no relation with it. So the answer is A, all except A. So Horner syndrome triad is anophthalmos, anhidrosis, and ptosis. So we'll go to summer 2017. Following type of carcinoma breast is characterized by Indian file pattern. So Indian file pattern is again invasive lobular carcinoma. So remember that. Pancreatic carcinoma following site is produces more jaundice. Now there are four parts of pancreas: your head, your body, and the tail, and the uncinate process, obviously. So your head is in direct contact with the second part of duodenum. So if there's a carcinoma of head of pancreas, it will compress your second part of duodenum, and that will lead to obstructive jaundice, right? So pancreatic carcinoma, which side produces more jaundice? It has to be head. Thymobody calcification, told you again, it's papillary carcinoma thyroid, papillary variant renal cell carcinoma, meningioma, and serous cystadenocarcinoma of ovary. So the answer is all of the above. Following hepatotropic virus is a DNA virus. HBV is DNA. HCV is RNA virus. Skip lesions of intestine are characteristic of your Crohn's disease. Ulcerative is continuous. Skip is Crohn's. Tuberculosis is circumferential. Spindle growing in herringbone pattern is characteristically seen in, again, you need to remember, it's fibrosarcoma. Combination of these findings. Now, this question may be asked in the name of integration. Ovarian tumor, hydrothorax, basically pleural effusion, and ascites. This is a classical triad of Meeks syndrome. So it is option number C. Rodent ulcer, another name for basal cell carcinoma, because it burrows. It's a burrowing ulcer deep into the skin, but does not metastasize. Exudate is predominantly located at the base of brain. In which type of meningitis? It has to be tuberculous meningitis, because it is relatively heavier, it has a higher specific gravity, and it will have a cobweb formation. So that is your tuberculous meningitis. Commonest benign tumor of parotid gland is pleomorphic adenoma, no doubt about it. All are associated with HCC, HBV, yes. HCV, yes. Aflatoxin exposure, yes. HEV, no. Hepatitis E virus does not cause hepatocellular carcinoma. Most common primary malignant tumor of bone, has to be osteosarcoma. And which is the location? It is metaphysis. Most common type of non-Hodgkin's lymphoma is, it is B cell type, right? Marginal B cell type. Long-term assessment of diabetes is provided by which of the investigation? Now, this may again be asked as an SAQ. HbA1c. What is HbA1c? HbA1c is glycated hemoglobin. So 5.6 to 6.4, I guess. That is your normal value of HbA1c. It gives a glucose control of past 90 days. Why 90 days? Because the lifespan of RBCs is 90 to 120 days. So glycosylated hemoglobin, HbA1c, long-term assessment of diabetes. Lung abscess secondary to aspiration. Lung abscesses are generally seen in the apical lobes because your oxygen availability vis-a-vis your blood supply is more. So oxygen is more. So apical lobes, the answer has to be upper lobe of either of the lungs. Neither right nor left, nothing is common. Is generally upper lobe of either lung. Atherosclerosis is an intima-based lesion. Always remember that. Monckeberg medial sclerosis is a media-based lesion. Atherosclerosis is intimal-based lesion. Right. Right. Which of the following conditions have unconjugated hypobilirubinemia? Now, it's an important concept that you'll have to remember the examples. So, you are unconjugated and conjugated. So, conjugated, you'll have Dublin-Johnson and Rotor. So, Dublin-Johnson and Rotor, that is conjugated. And Klegler-Najar and Gilbert is your unconjugated. So Klegler-Najar, Gilbert, prematurity, all of them will have unconjugated. Dublin-Johnson is conjugated, hyperbilirubinemia. Right. Flea-bitten kidney seen in all except. See, again, it's a repeat question. Flea-bitten kidney matlab kya? Particle hemorrhages rahenge. You will have acute post-streptococcal glomerulonephritis. Yes. RPGN. Yes. Hemolytic uremia syndrome. Yes. HUS TTP, immune thrombocytic purpura, uske saath rehta hai. Benign nephrosclerosis, no. You'll have a small contracted granular kidney. Long-term assessment of diabetes provided by glycosylated hemoglobin. So we are done with that. Now, commonest soft tissue sarcoma in children is rhabdomyosarcoma. If they are asked commonest tumor in children is eye tumor in children is retinoblastoma. Commonest kidney tumor in children is Wilms tumor. Commonest soft tissue sarcoma is rhabdomyosarcoma. Right. And commonest bone tumor in children is Ewing's sarcoma. Drop metastasis is commonly observed in. Now see, drop metastasis means your cells are disseminated via CSF. So if there's a cerebellar neoplasm, it is more likely to be metastasized via CSF. So the answer is medulloblastoma. Medulloblastoma is a tumor of your cerebellum. Following thyroid cancer is a neuroendocrine tumor. Neuroendocrine, again I repeat, it has to be medullary carcinoma. Thyroid, why? Because it produces calcitonin. So calcitonin paraneoplastic syndrome as well, right? Tuckenberg tumor is bilateral metastatic tumor from the following primary sites. Stomach, yes. Breast, yes. Colon, yes. Endometrium, no. Answer is D, endometrium. High risk, I told you. Low risk is 611. High risk is 1618. So 1618 is option C. Right. I forgot one question. Prostatic carcinoma leads to early metastasis. Now, breast and prostate both will generally metastasize to your vertebra. Breast will produce osteoblastic lesion. Prostate will produce osteoblastic lesion. Breast will produce osteolytic lesion. Just remember, but it is vertebrae via the Bateson's plexus of veins. Next question. Undescended testis following tumor develops. Even without seeing the options, the answer should be in there in your head. It is seminoma. Classic example of anti-GBM and anti-GBM disease, good pasture syndrome. Which pattern of immunofluorescence? Linear pattern of immunofluorescence. Yes. In acute post-streptococcal glomerulonephritis, which pattern you will see? You will see a granular appearance. Not linear, it will be granular immunofluorescence. Azotemia refers from elevation of. Now, uremia and azotemia, these are two words. Uremia is when you have an elevated uric acid or urea and creatinine. Azotemia is elevated uric acid, urea, creatinine along with signs and symptoms. That is azotemia. So, elevated blood urea, yes. Blood urea nitrogen, yes. Uric acid, no. So it's basically urea and creat only. My bad, it's not uric acid. Urea, yes. Urea nitrogen, yes. Creat, yes. Not serum uric acid. So option C is incorrect. Because if it to have been increased serum uric acid, it would be gout, right? Pseudomembranous enterocolitis occurs mostly in association with clostridial food poisoning. You'll have to remember that. Barrett's esophagus predisposes to adenocarcinoma. See, reflux esophagitis will cause Barrett's, and long-term Barrett's will cause adenocarcinoma. So reflux esophagitis leads to Barrett's, Barrett's leads to adenocarcinoma. Which type of metaplasia? Columnar metaplasia. Following type of bronchogenic carcinoma, worst prognosis, I've told you again, it is small cell carcinoma. Classic and alpha-1 antitrypsin deficiency in emphysema has the following things. So see, PIMM. MM means it is all good. M is not normal allele. ZZ means it's a severe thing. And MZ is it's moderate. And M0 is no allele. So classic is a severe thing. So severe thing is PIZZ. Remember it. This is a very tough question even from medicine perspective. None of us is generally expected to answer it. But since I have gone the extra mile and studied about it, I'm telling you it. It is PIZZ. M is normal, 0 is absence, Z is severe. So PI double Z, which is homozygous for that Z allele, that is a severe emphysema. Now, this is a very long history. I will not be reading everything. What is the important thing? He has told us that his ALT is raised, AST is raised. That means hepatitis is present. Total bili 3, cool. It should be generally less than 1. Liver biopsy performed, interface inflammation, extensive inflammation, focal bunneling degeneration, all of these point towards Hep B. Hep B is the answer generally, but what will you see first in FB? Hep B, positive hepatitis B surface antigen, HBsAg, hepatitis B surface antigen, that's your clincher, has to be P. Antimitochondrial antibody, these are generally seen in your autoimmune diseases, not here. Which type of breast carcinoma is likely to be bilateral? Bilateral multicentric, only one thing in your mind, lobular carcinoma. Enzyme used as a marker for alcoholic abuse is AST. SGOT or AST is generally the same thing. So aspartate aminotransferase is the thing. And for obstructive, it was alkaline phosphatase. Hashimoto's thyroiditis, increased risk for, now it's again a controversial question. Pathology book says it is papillary carcinoma, surgical book says it is lymphoma. If I am given an option, I'll go for carcinoma, papillary carcinoma, because papillary carcinoma is more common than lymphoma. Verruca bodies seen in schwannoma, remember it. Psammoma bodies seen in meningioma. Soap bubble appearance is in X-rays. Soap bubble appearance is classical of your osteoclastoma. Sunburst appearance, Codman's triangle appearance. This is seen in osteosarcoma. Ewing sarcoma is onion peel appearance. Soap bubble appearance is seen in osteoclastoma, right? Ciliate oval bodies is seen in yolk sac tumors. Again, there's nothing you can do about it. You just have to remember it. Ciliate oval bodies, yolk sac tumors. In yolk sac tumor, with specifically endodermal sinus tumor, right? Aschoff bodies in rheumatic heart disease shows all except epithelioid cells, yes. Antique-Schko cells, yes. Fibrinoid necrosis, yes. That's why rheumatic heart disease, the example of type 3 hypersensitivity. Aschoff giant cells, not seen. So A, B, C are seen, D is not seen. Most common vessel in myocardial infarction. It's also known as the widow's artery. Why? Because it is the most commonly involved in heart attack. It has to be LAD, left anterior descending artery. So answer is B, left anterior descending. Right. Renal cell carcinoma most commonly metastasizes to, now it will go upwards via your renal veins, then your inferior vena cava, liver, and finally it will get arrested in your lungs. So the most common site is your lungs. Epithelial crescent formation can be seen in all except diffuse proliferative, yes. Membranous, yes. Rapidly, yes. Notch-Schonlein papilla, no. Hanach-Schonlein papilla, you'll see mesangial deposits. You will not see crescent formation. Apologies for the poor quality of the print. It's not that I have taken the photos. I had just received it on my phone and I have uploaded it as it is, just to save time. All other features of acute hepatitis with hepatitis B virus except ground glass appearance, yes. Ballooning degeneration, yes. Apoptosis and interface hepatitis. Interface hepatitis is generally not seen. So answer has to be interface. Sorry, apoptosis is generally not seen. You may see interface hepatitis. Option C and D, they are very close. Again, in all humility, I'm not pretty sure of that answer. Just go through acute hepatitis Hep B again as an LAQ. It may be a bit odd, but it might come because, as I've told you, a paper one has been relatively easy. Mortality rate is highest in pregnancy with infection of which hepatotrophic virus, without doubt, has to be hepatitis B virus. All of the following are features of Crohn's except inflammation limited to mucosa. Wrong. It is a transmural inflammation. Granulomas are present, yes. Ileum and colon, yes. Skip lesions present, yes. That's true. So option A is incorrect. Commonest complication of peptic ulcer is bleeding. Commonest complication of your Salmonella typhi ulcer is perforation. Charcot-Leyden crystals, bronchial asthma. Right. Bronchitis is Reed centric. Right. So we have completed summer 2016. Only 3 or 4 more papers remain. Let's complete them. Following substances impart black color to urine. So melanin, yes. Homogenesic acid, yes. Alkaptonuria. Aniline dyes, yes. Phenol does not impart pupil. It does not impart black color. Skip lesions, classical of Crohn's disease. Tuberculous ulcers, circumferential, typhoid, longitudinal, amoebic, flash shape. Rape-like chorionic villi, again, you need to remember it's seen in hydatiform mole or also known as H mole. Cerebral infarcts occur most commonly in areas supplied by. So there's again a controversy. Is it middle cerebral? Is it anterior cerebral? They say that it is anterior cerebral because internal carotid artery gives 2 branches, no? Anterior cerebral, middle cerebral. So both are generally more prone for developing infarction, but anterior cerebral is a better answer, right? Following brain tumor commonly shows calcification. Remember, it's ependymoma. Most common brain tumor, pilocytic astrocytoma. Showing calcification, ependymoma. Medulloblastoma, skip metastasis cerebellum. 5-year-old, generalized edema, selective proteinuria, hyperlipidemia, lipiduria, hypoalbuminemia. Classical nephrotic syndrome, response to steroid. Morphological feature, नाम में ही है, minimal change disease, nephrotic syndrome. So what you will find loss of podocyte food processes. So uniform and diffuse loss of podocyte food processes. So that's the answer. The answer is A. Crescent nahi. Crescent is seen in RPGS. Focal segmental nahi. Diffuse thickenment of basement membrane nahi. That is seen in good pasture. Right. Cervical carcinoma diagnosed early course with, so screening test they are asking. Screening test is Pap smear. Pap smear is basically your exfoliative cytology. So the answer is B. Exfoliative cytology, Pap smears. Stoma uri is composed of a trick question. Star market. Stoma uri generally has thyroid tissue. It does not have stomal tissue. It is thyroid tissue. Stoma uri is collagenous. It's not collagenous. It is thyroid. Right. Fibroadenoma of breast has following features except most common benign tumor. True. Young women, yes. Stromal cells are monoclonal. That's true because I've told you it is fibrous plus adenomatous component. Almost always becomes malignant. Absolutely wrong. It has almost nil malignant potential. Right. So the 7th question is following type of meningitis shows abnormally, so shows normal CSF glucose level. So in lymphocytic meningitis, you will see normal glucose. In bacterial, you will have utilization of glucose, right? And Cobb-Vec formation is your tuberculous meningitis. Remember, meningitis was asked as an LEQ during our time. Again, after 5 years, it may get repeated. So study it well. Following tumor is marked by ectodermal differentiation. Ectodermal differentiation has to be ectoderm आया मतलब embryonal carcinoma, right? Following carcinoma of breast shows pronounced lymphoplasmacytic infiltrate. Lymphoplasmacytic again it has to be medullary. This has been repeated twice. Invasive ductal best. Invasive lobular single file pattern BRCA mutation. Sorry, BRCA is medullary. Lobular में और क्या था? Bilateral multicentric, right? Thymo body seen in yes, A, yes, B, yes, C, yes, D, all of the above. Following type of carcinoma thyroid secretes calcitonin. Answer is medullary. Most common tumor arising on sun-exposed site has to be squamous cell carcinoma. It's not basal, it's squamous cell. And there's this line joining your angle of mouth to your tragus of the ear. And above that, generally you will have basal cell carcinoma. Medulloblastoma is a lesion of cerebellum. Answer is cerebellum. Right. So winter is also done. Next is summer 2015. Faucet's test in urine is positive for. Faucet test is generally for bile pigments and it is bilirubin. It's not biliverdin or urobilinogen, it is bilirubin. Hashimoto's disease serum antibodies mainly against, it is anti-TPO, anti-microsomal and anti-thyroglobulin. So the answer here is thyroglobulin. Lardaceous spleen. Sago spleen, lardaceous spleen. Kisme hai ye? This is seen in amyloid. So that is amyloidosis. Papillary necrosis, again a repeat question 3 years back. Analgesic nephropathy, yes. Sickle cell anemia, yes. Diabetes, yes. Analgesic may be mainly कौन से aspirin. All of the above, obviously all of the above. Hypoplastic arteriosclerosis, hypoplastic seen in malignant hypertension. Remember the answer is D, malignant hypertension. Monkeypox is medial sclerosis. Atherosclerosis is intima based lesion. So it is not there. Burgess is no, it generally affects your veins. It generally affects your arteries, but it is claudication of your arteries due to smokers. It's seen in smokers. Don't smoke. Blood stain discharge from nipple indicates, again, it's a tough question. You are not expected to know that. The answer is papilloma. Papilloma will have a blood stain discharge. Breast abscess will have a purulent discharge. Fibroadenoma will not have a discharge. Fat necrosis, most common type of, tigroid effect on heart is seen in, like, this is a question from your first part of general path. Tigroid appearance is fatty change. Why? Because heart generally uses fat for metabolism. So the answer is fatty change. Most common types of Hodgkin is nodular sclerosis, mixed cellularity, Reed-Steinberg, lymphocyte predominant, popcorn cells, lymphocyte depletion, worst prognosis. Most commonly affected vessel, coronary atherosclerosis is anterior descending branch of left coronary, basically left anterior descending. Schwannoma, Perroquet bodies, without doubt. Lewy body seen in Parkinsonism. Pig bodies, I'm not sure if it's seen in Alzheimer's or somewhere, just confirm it. Complication of tuberculous osteomyelitis includes all except Pott's disease, yes. Psoas abscess, no. Amyloidosis, no. So the answer generally spots. See, even psoas abscess can be there, but since amyloid, I'm not very sure. Just check this answer again. I think it's only Pott's. Yeah. Periglomerular fibrosis is characteristic of. So will it be? So firstly, it is glomerular, so it cannot be pyelo. So this is gone. Benign nephrosclerosis, no. You'll have benign nephrosclerosis. You'll have a vessel which has a reduplicated basement membrane. Acute versus bacha kya A and C. Can acute have fibrosis at this point in time? No, it will not have. It will have cellular proliferation and crescent formation. Fibrosis nahi rahega. So fibrosis hai matlab it is chronic glomerulonephritis. So this way you can eliminate your answers, right? Cervical scrape smears, exfoliative cytology. किसके लिए? Pap stain for cervical carcinoma. Heart failure cells, hemosiderin laden macrophages, pigmented alveolar macrophages seen in left heart failure. I've told you again and again. So if not, then refer my previous videos. Carcinoma colon stage 2B. Now, again, this is not expected of you all. Stage 1 is mucosa limited. Stage 2 is muscularis propria limited. Stage 3 is serosal. Stage 4 is metastasis. So B2 is basically your muscularis propria. Remember that if you can. Even if you remember that, it's fine. More than enough. Firm warty vegetations along line of valve closure. Typical definition. It has to be rheumatic endocarditis. Acute endocarditis, a large chunk or a large vegetation and which extends up to the chordae. Libman's axis on either surface. Subacute is multiple but distinct. They are not continuous, unlike rheumatic. Answer has to be rheumatic endocarditis. Low radioactive iodine uptake with high T3, T4. See, high T3, T4, that means hyperthyroidism. But how is it having low iodine uptake? Low iodine uptake means that is basically Hashimoto's. But in that stage, in one stage, it is showing high T3, T4. So that is Hashitoxicosis. So again, this is a wonderful question. Our answer should be Hashitoxicosis. It is not painless thyroiditis. Painless thyroiditis is Riedel's thyroiditis, not the answer. Dequervance is painful after a viral infection. So again, that is not the answer. Answer should be Hashitoxicosis, according to me. Grade 1 transitional cell carcinoma. Transitional cell carcinomas generally have a papillary pattern or a fungating pattern. So the answer is 15th is papillary. Calcification seen in ependymoma. Remember it, don't forget. Hallmark of chronic pyelonephritis is, what is a hallmark? You'll have a loss of corticomedial differentiation, that's true, and there will be a scar over the deformed calyx, right? So corticomedullary scar over the calyx, that is pyelonephritis. Pyelonephritis is basically your collecting system, right? Hyaline arteriosclerosis, no, it is seen in benign nephrosclerosis. Thyroidization, no, seen in chronic glomerulonephritis. Most common hepatic benign tumor, hemangioma. It is not an adenoma, because though we say that liver, it is generally not a gland per se, It's not secreting something as such, but it has a rich blood capillary network. So the most common hepatic benign tumor is hemangioma. Warthin's tumor is seen in salivary gland, second most common after pleomorphic adenoma. What is it? It is again an adenolymphoma. Adenolymphomatosis it is known as. Small tubular heart, again it's an odd question. The answer is emphysema, remember it. Myocardial infarct, which necrosis? Without doubt, coagulative necrosis. Which type of infarct? Pale infarct or white infarct. Right, just two more papers to go. Drumstick appearances, appendages seen in neutrophils and stained blood film in females are generally more than 20%. Right, so bar bodies and drumstick appearance, drumstick appendages, characteristic in females. Most common soft tissue sarcoma children, told you again, it's rhabdomyosarcoma. Seminoma is a malignant tumor. It's not a benign tumor. I have told you, despite being OMA, it is an exception. Features nephritic syndrome. Nephritic syndrome, heavy proteinuria, no. Subnephrotic proteinuria, so mild proteinuria. Hypertension, yes. Microscopic or gross hematuria, yes. Oliguria, yes. Answer is heavy proteinuria. Heavy proteinuria bola to nephrotic syndrome. Zone of liver lobule, which is more prone to all forms of toxic injury, which is it? It is central lobular, right? Central lobular. Why? Because it is away from your periportal zone. Periportal zone में क्या है? Hepatic artery, bile duct, portal vein. Hepatic artery तो है, oxygenated supply तो है. Central lobular में क्या है? सिर्फ central vein है. You will only have deoxygenated blood, so that is more prone for toxic injury. Pseudocartilage in mixed salivary gland is a product of, I'm not sure. They say it's ductal epithelial cell origin. I'm not pretty sure of it. Just check it once. Cholesteatoma of mastoid is characterized as, it's basically a hamartoma or a hematoma, whatever you call it. It's not a benign or a malignant tumor. Inflammatory pseudotumor also does not fit the bill. I'm not sure if the question, if the option was hematoma, but since they have given it, just remember it. Most common cause of lobar pneumonia, be it lobar pneumonia, be it lobular pneumonia, any pneumonia. Most common cause wherever it is, has to be strep pneumonia, except in children. In children, it is a beta hemolytic, group B beta hemolytic streptococci. Yeah, but in overall, it is Streptococcus pneumonia. Right. So, which of the following is true about basal cell carcinoma? Usually metastasis. False. It's not true. Lesions are flat. Let's see. No, because it's known as basal, so it is a cauliflower-like appearance. Lesion is always single. No, there are multiple. Tumor is related to immunosuppression. That's true. These generally arise in people who are immunocompromised. Right. Azotemia refers to, what is azotemia? Elevated urea and creatinine. I've told you again and again. Uremia is basically elevated urea creatinine along with symptoms known as azotemia. Uric acid को नहीं गिनते इसमें. Cryptococcus neoformans, a microbiology question, India Ink preparation, you'll see a peri-halo. You'll see a halo there. So India Ink preparation for Cryptococcus neoformans. Fixed specific, my bad. Most frequent cause of nephrotic syndrome in children has to be MCD, also known as lipoid nephrosis. Sickle cell disease, which osteomyelitis? Salmonella osteomyelitis. Risk factor for pigment gallstone is hyperlipidemia, yes. Gender, yes. Oral contraceptives, yes. Biliary infection, I'm not pretty sure. From what I remember, biliary infection is not a risk factor for pigment gallstones. Solitary thyroid nodule is more malignant when, see, if it is a cold nodule, means radioiodine uptake is less. If it's a young male, cold nodule, young male, solitary nodule, all of them, and solid nodule, all of them are having increased risk of malignancy. So hot, no. Older age group, no. Young male. Cystic, no. Solid. Young male, yes. So solitary thyroid nodule is more malignant when the patient is likely to be a young male. Complications of hepatic failure are all except portal hypertension, yes. NCAF, coagulopathy, yes. Proteins are not produced. Your urea is not excreted. Multiple organ failure, no. MODS is generally related with kidney failure. It's not related with hepatic failure. Benign nephrosclerosis shows all except hyaline thickening of vessels, yes. Febrile necrosis, no. Febrile necrosis is seen in malignant nephrosclerosis. Diffuse tubular atrophy, yes. Reduplication of elastic lamina, yes. Febrile necrosis is generally not seen. Right. And which is the next thing? Peutz-Jeghers polyps are which type of polyps? Peutz-Jeghers polyps are your hamartomatous polyps. So the answer is B, option B. It is hamartoma. Which of the following does not lead to bronchiectasis? Mucoviscerosis, yes. Cartagena, yes. Prolonged bronchial obstruction, yes. Pneumoconiasis, no. Pneumoconiasis is an interstitial lung disease. It is not an airway disease. Mark my word. So airway disease नहीं है तो वो block नहीं हो सकता, तो वहाँ पे secretions नहीं आ सकते. So pneumoconiasis is the answer. So bronchiectasis नहीं होगा. Which of the following is not prognostic in carcinoma breast? Now see, staging and grading. Grading is generally not prognostic. Staging is prognostic. तो ग्रेडिंग में क्या क्या है, तुम्हारा हिस्टोलॉजिकल सबटाइप इज इन योर ग्रेड, बट स्टेज में जनरली क्या ईआर पीआर हर2 न्यू, जो नया स्टेजिंग सिस्टम है, ईआर पॉजिटिव पीआर पॉजिटिव हर2 न्यू है या नहीं, बीआरसीए1 है या नहीं. सो ईआर स्टेटस यस, BRCA gene status yes, lymph node status yes, metastasis status yes, but histologic subtype no. That is with respect to grading. Grading does not have any bearing on your prognosis. Medullary carcinoma, thyroid, parafollicular C cells, obviously. Cirrhosis with skin pigmentation, diabetes, Crohn's diabetes, hemochromatosis, without doubt. Lymphoma endocarditis occurs in SLE, I've told you, and vegetations on both sides of the wall. Hodgkin lymphoma, popcorn cell, lymphocyte predominant, which is your non-classical Hodgkin's. True. Now we only have one paper left, if I'm not wrong. Two papers left. Right. So specific gravity or isostenuria, again, it's a medicine level question. It is generally seen in severe renal damage. When you have tubular necrosis and chronic kidney disease, you'll have isostenuria. Your specific gravity won't change, but that means your urine won't be concentrated. That is indicative of severe renal damage, which is C. Vircho's node is enlarged or malignant supraclavicular lymph node. Left supraclavicular lymph node is Vircho's node. Generally, it is because of your gastric carcinoma from the stomach. Tetralogy of Fallot, right ventricular obstruction, yes. VSD, yes. Right ventricular hypertrophy, yes. Atrial septal defect, no. It is ventricular septal defect. So tetralogy of Fallot में क्या होता है? You have a ventricular septal defect. As a result, blood will go from high pressure to low pressure. So left से तुम्हारे right में जाएगा. So you'll have right ventricular hypertrophy. Again, there is pulmonary stenosis. Again, you will have right ventricular hypertrophy, and you have an overriding of aorta. So this is a tetralogy of Fallot. Carcinoma prostate, commonly metastasis to bone. Which bones? Your vertebra. Following type of emphysema with alpha-1 antitrypsin, Panacea. I have explained it. Go back, rewind, and watch it again if you have time. Panacea. Post-infectious glomerular nephritis has following features except what is it? Granular Ig and C3 in GBM? No. It is seen in granular, granular है. Subepithelial humps, yes. Subendothelial deposits, नहीं. Subendothelial नहीं है, subepithelial है. Right. And granular appearance in नहीं है. Enlarged hypercellular glomerular, that's true. Most prevalent chronic occupational lung disease in the world is coal workers pneumoconiasis. It's not silicosis, it's coal workers pneumoconiasis. A lot of people work in coal mines more than silica mines. Following are major etiological factors associated with HCV, hepatocellular carcinoma, HCC. Chronic viral infection, yes. This is DNA, this is RNA. Chronic alcoholism, yes. Aflatoxins, yes. Ophistosarcus infection is gallbladder cancer. Ophistosarcus viveni, gallbladder cancer, not this. And cystosoma hematobium is your urinary bladder cancer. Clear or granular cytoplasm of tumor in clear cell RCC is because of glycogen. Glycogen which is there, which is used as a source of energy, that gets cleared. That is C. B, glycogen. Hashimoto's thyroiditis is autoimmune. Autoimmune means immunological mediated disorder. Our answer C. Crypt abscess seen in ulcerative colitis. Right. Flask abscess, amoebic colitis. Causative for uterine cervical cancer, HPV. Epstein-Barr causes nasopharyngeal carcinoma. Cytomegalovirus in immunocompromised people. HSV also causes cancer. Yes, skin cancer. Following pathogen, frequent cause of osteomyelitis with sickle cell, again repeated for the nth number of time, it is salmonella. And thymobodies may be observed in all, yes, A, B, C, except D, true. Serofibrinous pericarditis, see, there are two pericarditis. Serofibrinous hemorrhagic. Hemorrhagic किस में रहेगा? When you'll have your deficiency of clotting factors, so the answer is bleeding diathesis. उसमें hemorrhagic रहेगा. Dressler's, uremia, rheumatic, all of them are serofibrinous. So if you carefully observe the pattern, in every 20 questions or 16 questions, there are at least 2 questions which you are not expected to know. It's like a fluke. If you get to know, it's good. If not, it's still manageable. So that's the reason I am telling you these. So I don't want you to lose marks there. Not which of the following lung disease will not cause cor pulmonale? Cor pulmonale is right-sided hypertension. So right-sided hypertension, most common causes are interstitial lung diseases and chronic obstructive pulmonary disease. So will A cause it? Yes. B cause it? Yes. Emphysema? Yes. Empyema is lung infection of pleural fluid. Yeah, infected pleural effusion is basically emphysema. So that will not cause your cor pulmonale. Most common salivary gland tumor, pleomorphic adenoma, not Warthin. That is pleomorphic. Markedly raised serum alkaline phosphatase, obstructive jaundice has to be C. Which carcinoma follows indolent? Indolent means a relatively slower course, better prognosis. That is indolent. Obviously, best prognosis papillary, worst prognosis anaplastic. Answer has to be B, papillary. Which of the following increased risk of CA esophagus? So it is well noted that Plummer-Vinson syndrome has an increased risk of CA esophagus. So what is Plummer-Vinson syndrome? Plummer-Vinson syndrome is your esophageal webs, iron deficiency anemia, and cheilitis or glossitis. Cheilitis is lips, glossitis is staging of breast carcinoma. Again, क्या बोला था मैंने? Grading and staging. So staging is basically on the basis of your lymph node status. ये जो A, C and D है, सबके सब क्या है? Grading के लिए. Cells कैसा है? Formation कैसा है? But metastasis, tumor size, lymph node, that is your staging. Following type of nevus has increased risk of malignant transformation. They generally say that it is congenital. Even I am not sure. Do check it once. Which type of Hodgkin's? Best prognosis? Nodular sclerosis, without doubt. Massive splenomegaly is a feature of storage disorders. All of these A, B, C, they'll lead to acute conditions. They might not lead to very significant splenomegaly. Storage diseases, congenital, massive splenomegaly. Answer given is incorrect. Lysis of ribs with fibrinous exudate seen in resolution phase. It's not seen in red and gray. Red and gray is generally seen. It is restricted to lungs. It's not restricted to its surrounding tissue. Surrounding tissue aaya to resolution, right? And final 6 questions. Which of the following ovarian tumor? 6 cord tumor. Ab 6 cord tumor पूछा है. So see, your choriocarcinoma is a germ cell tumor. Yolk sac, germ cell tumor. Fibroma thecoma is 6 cord tumor. Teratoma again, germ cell tumor. Chain of HPV is low risk for CA cervix, which is low risk 611. So 11 है क्या option में? Yes, 11 is there. Following tumor is associated with paraneoplastic syndrome. Obviously, ये तो कल भी आया था शायद. It is bronchogenic carcinoma. Etiology of pneumoconiosis is inhalation of any dust. Any dust is there. So, but dust containing, so option between option C and D, I'm not very sure, but mineral dust, yes. Silicosis, asbestosis. Organic dust, yes. Dysinosis, bagasosis. I'm not very sure about C and D. They have given the answer as D, but just check it once. Following morphologic feature is seen in alcoholic hepatitis. कौन सी bodies? Maillary Dengue bodies. Councilman bodies in viral hepatitis. Following disease is a feature of hypertensive heart. Following is a feature of hypertensive heart disease. It is concentric left ventricular hypertrophy. That's true. So ये सब का सब हमने कर दिया है. So with this we are over with part 2 pathology. It is very high yielding, very high scoring. Go through it, and I'm sure I'll be uploading it before time. Apologies because I did not have a better internet connection, and because of that I couldn't upload it, but I'm sure I will upload it in time. Which are the LEQs you need to focus on? I personally believe atherosclerosis is one of them. Then you should do a gastric ulcer, and on the higher side, if you see, if a question on kidney comes, that will be one of the worst nightmares because it's very complex. Classify glomerulonephritis, so it's very complex. One on endocrinology, either thyroid or either one on diabetes. Has to come means has to come. It will definitely come. Breast and SCQ can come on the benign lesions of the breast. Most probably is fibroadenoma. You'll have to draw both intracanaliculaar and pericanaliculaar. You can have melanoma as a diagram. You can have seminoma as a diagram. Then besides from lungs, you'll generally have other SCQs. Your pneumonias, your emphysemas, your lung tumors. Very important. From heart, you'll generally have, you may have infarction, but I think last year that was asked, so it might not be asked this year. So go through that again as well. Changes and your liver, your cardiac enzymes with respect to that. Again, for something as an off topic, you can have various types of hepatitis and various types of cirrhosis. So do cirrhosis and classify cirrhosis, classify hepatitis, define cirrhosis, define hepatitis. Very important. So with this, I hope you luck. I hope you well, and hopefully this would help you ahead as well. Thank you. This is Jay signing off.